DESIblitz.com.
So a typical working day for me could be different depending on where I'm working, whether it's working on a ward or an acute emergency unit. But working on the ward, I work on the geriatric wards, which is the care of elderly. It involves attending to all of the elder patients in the morning, most of them have dementia. So, doing a ward round, getting medications, doing specific investigations for them. But it's different when we go to the acute emergency unit dealing with COVID patients, because most of the patients who come there do require oxygen, and they can decline in terms of their health quite quickly, and they need to be escalated to the ITU. But having said that, there have been success stories. We've been able to treat patients. It's been a long journey, but we do get there. But at the same time, we have faced quite a few fatalities, and quite a few patients have a need to be put on end-of-life care.
So typical working day for me is that we have together in the morning with the morning meeting with our consultant and registrar. Then we have to see the patient list that has been admitted overnight, and the patients who are requiring the more oxygen, and therefore the escalation. Then we have to decide whether we have to involve the ITU in this service or not. During the COVID situation, it's been a really difficult time for us as we to decide whether which patient needs the ITU support or which patient is just for the non-invasive ventilation. During the second and the third peak, I have seen that I observed personally as well that the mortality rate was much more than the first wave. So in front of us, when the patient is dying and we are not able to do something at that time, that's a much stressful situation for us as well as for the relatives as well. So we try our best, and we try our best to give the treatment in the best interest of the patient's health.
We are here in front of the ward 303, that is basically a renal ward. And due to the COVID situation, we have divided that ward into the two bays, like one half is the COVID one and the second half is the non-COVID.
The professional challenge for me is like I usually work as a renal JSD and work in the renal medicine ward, but during this pandemic, due to the staff's the shortage of staff and for the patient safety, our trust has taken the decision that they have divided the juniors according to the floor requirement. So I'm not sure on the day I have to go specific to the renal ward. So sometimes I have to work into the gastro ward, into the liver ward, or sometimes into the cardio ward. So when I go to the new environment, into the new ward, that's a bit professional challenge for me when I see the cardiac specialty patient and the liver specialty patient.
I'm just going to take you a tour into my ward. All right.
Thank you. Cheers.
Just come in.
All right. Who's this here?
This is our ward, and it's basically it's a combination of cubicles and bays. So what we tend to do is, obviously for coronavirus patients, we need to isolate them. So we put them in cubicles, and they have isolation walls. Like for this patient, it's contact isolation. But if we go further there, patients who are respiratory, they would have a sign of respiratory isolation to ensure anybody who doesn't know if the patient has COVID, that we have the proper gear and the PPR before we go in. Patients, obviously, other than COVID, they are in bays, and sometimes, like when the pandemic was on its peak, we had to put patients in bays, but then we had to isolate the whole bay. Professional challenge being for me working in a geriatric ward, like I said, involves elderly patients. Most of them have dementia, and it has been found, and it's been a study, that patients who have COVID at this age tend to develop delirium, and the delirium is very long lasting, and this delirium hinders our treatment, because sometimes these COVID COVID patients most of the time needs oxygen, these patients won't keep the oxygen mask on, they would not comply with the treatment, they become very agitated. So getting to them to calm them down, getting that treatment into them, and then obviously, just planning ahead becomes very difficult for us.
There are times that I miss her, that we don't spend much quality time nowadays during this pandemic.
Our married life has been impacted immensely, and I think one of the reasons being because I work in Kingsmill Hospital, the Sherwood Forest Hospitals, and he works in Birmingham, Queen Elizabeth University Hospitals, Birmingham, and it's quite a far, and we are based in Nottingham, so it's quite, both sides are quite a distance apart, and we have different hours of working, and there have been times when we have not met one another for quite a few days, and I think with this COVID we're all to be around our households, we only can mingle with them, but for us it's become very, very difficult because we, being households, can't even get to see one another.
South Asians are at high risk in COVID-19, as I will give a quote of a study that has been published in June 2020 by the Public Health England. What they concluded in that study, that the BAME groups, in that the Bangladeshi population is at twice risk of dying rather than the British white population. And the second study, in which they mentioned that the Pakistani, the Black Caribbean and Chinese, they are like 10 to 15% at high risk of dying as comparison to the British white population.
Fit and healthy South Asians are seen to pass away from COVID-19, and I think one of the major reasons that we know is actually the ethnicity. So apart from the ethnicities, there's not had be any further studies that tells us why they have the disease, and when they have the disease it tends to be more fatal in them as compared to other people. One particular thing I would like to mention is that male gender tend to have a higher risk as compared to the female gender. So when we're having those risk assessment, the male gender tends to score just for the sex, other than having other comorbidities. There's certain other risk factors which are more common in these ethnicity, that would be diseases like diabetes, obesity, and I think general lifestyle. And when I say lifestyle, it's about the dietary habits. Most of these communities usually tend to eat food which is more high in oil, butter. I would just like to advise everybody that you should all have a healthy lifestyle, do your regular exercise, try to have even portion of protein, carbs and fats to make sure that we do not add additional risks to ourselves with our lifestyle.
The people who basically got the vaccinated are much more protected. The people who got the real disease and then got the antibodies, so it's equal to those people, and in some people they saw their vaccination is protecting more than that. Let me reassure you that this is safe and it has been proved by the higher authorities. So concern regarding the reactions, so it's a general thing that we can get the reaction from any of the medication, and this thing can happen by the COVID as well, but the ratio and the people who are getting the vaccinated, the reaction rate is really, really low. So the importance of the vaccine is, my message is to the all population that please get vaccinated.
I think we've done very well as a nation in counteracting COVID-19, but at the same time I would like to say we still need to be very vigilant. We need to follow guidelines which are laid down by the government. We do have high hopes with the vaccination, but having said that, we still need to play our part as a responsible citizen. There are people who, I think, in my belief, I think they still think COVID does not exist, and they don't want to follow the guidelines, they don't want to wear a mask, or mingling with households. I just want to give a message that this is actually no joke. We being doctors have seen patients dying, being on ventilators and being without their family. I wish I could actually take some of these people to these hospitals where patients are sick to make them believe actually this is something true, and as a nation we should rise up and help ourselves and help those who are suffering in the hospitals.
On the clinical side, I have done a lot under my capacity, but I would like to thank my trust that they gave me the opportunity to get the training as a vaccinator. I can be a role model as a vaccinator, so I can give the jabs to the patients.
I have done quite enough and to the best of my capacity in these times, but I think there's one particular thing I would like to do is to train myself into doctors with qualities in ITU. So there have been times when our trust, the Sherwood Forest hospitals, have been running to train junior doctors in capacity of the limit and in the limitations to work for ITU. And in future I'm planning to train myself for ITU procedures, because that involves dealing with very, very sick patients who are ventilated, and we work in a very close protected environment. So that's my plan in future, to get myself trained and help the people who are suffering.
As COVID is manageable at the moment, and I'm hoping from April 2021 onwards, we are hoping that we'll get back to our normal rotas, and then we can work in our speciality. Like I'm working in the renal medicine, so I will specifically work in the renal medicine ward. Then I can learn a lot during the different diseases that are specific to the renal medicine.
I think as COVID is taming down, one of the great impact on me, it's going to be that I can actually pursue my education. I was supposed to give quite a few exams to pursue into my training, but with COVID being there, our clinical responsibilities were much more, and we had to give away our education, our exam timings. So I'm hoping all that gets sorted out and I can pursue and progress in my training.